From the PEP Radio Newsroom, this is the Lunch Hour News Blast for October 14th, 2025. LGBTQ Nation is reporting that a new report revealed that transgender and non-binary immigrants in Los Angeles experience higher rates of poverty, homelessness, and unemployment, as well as greater disparities in accessing education and healthcare than non-immigrant, trans, and non-binary Angelenos. However, the report also showed that trans and non-binary immigrants reported better mental health than non-immigrant, trans, and non-binary Angelenos, and were more likely to ask law enforcement officers for assistance and more likely to run for or hold political office, all of which surprised researchers. While the study doesn't necessarily reflect national trends and was conducted before the president took office for his second term, it nonetheless paints a picture of the challenges faced by two groups increasingly targeted by the administration. The survey conducted by the Trans-Latin Coalition and the Williams Institute asked 322 trans and non-binary respondents living in Los Angeles about their life experiences. Of the respondents, 98 were immigrants, and of those 98, 66 identified as trans Latinas, 20 identified as non-female Latinos, and 12 identified as simply non-Latino. Among the survey's findings, approximately 73% immigrant respondents reported living at or below the poverty level, the federal poverty level, that is, compared with 44% of non-immigrant respondents. The federal poverty level is only $15,650 for an individual, or $32,150 for a family of four. Approximately 47% of immigrants were unemployed, compared to 22% of non-immigrants. Approximately 39% of immigrant respondents reported experiencing homelessness, compared to only 19% of the non-immigrant participants. And 47% of immigrant respondents experienced unemployment, again, compared to 22% of non-immigrants. Additionally, 30% of immigrants had less than a high school or GED level education, compared to 8% of non-immigrants. Immigrant respondents were almost twice as likely as non-immigrant respondents to use public transportation to commute to work or school, and they were nearly twice as likely to report an inability to get to work or school at some point in the last 3 months because of transportation issues. About 30% of immigrant respondents reported being uninsured, compared with 7% of non-immigrant respondents. As a result, 36% of immigrants reported their health as being fair or poor, compared to 23% of non-immigrants. Approximately 18% of immigrants reported not accessing any health care whatsoever, compared to 8% of non-immigrants. And 25% of immigrant respondents said they felt comfortable accessing services from government offices, compared to 8% of non-immigrant respondents. Interestingly, 35% of immigrant respondents reported having fair to poor mental health, compared to 43% of non-immigrant respondents. This disparity could be due to community organizations providing targeted services to help transport trans and non-binary immigrants to and from appointments, and culturally competent telehealth services, which do not require physically attending appointments, the report's authors wrote. Also, equal percentages of immigrant and non-immigrant respondents reported having access to gender-affirming care, but while 21% of non-immigrant respondents reported the ability to access gynecological care, only 8% of immigrant respondents reported the ability to access said care. Generally, non-immigrants were more likely to access gender-affirming care through a private medical system, while immigrants were more likely to access the care through a public medical system. Another interesting find. While 48% of non-immigrant respondents were likely to delay or not get gender-affirming care, 32% of immigrant respondents said the same. The explanation for these differences is unclear. Of the immigrant respondents, 63% had applied for political asylum status. 87% applied solely due to their LGBTQ plus identity. And 79% of those applicants received some form of legalized status, allowing them to stay in the United States. So a majority of those who didn't apply either didn't know how to apply, were afraid to do so, or didn't think that their applications would be approved. The 2024 presidential election resulted in a shift in federal policy on both immigration and transgender rights, likely affecting many of the respondents to this survey, the report's authors wrote. Because the survey was conducted in 2023 and 2024, before the election, it's likely that the current administration's policies have increased the negative experiences of trans and non-binary immigrants and non-immigrants alike. Further research could further assess the barriers that inhibit trans, non-binary, and immigrant access to social support services, including language barriers, a lack of culturally competent service providers, and other factors, the report's authors wrote. And that, with a lot of statistics tossed in there, is the news blast for this hour. And if you're watching our news videos on YouTube, please be sure to subscribe to our channel. Up next, we have the Meadville area weather forecast right here on PEP Radio.